Sorry.
Is that not looking familiar?
No, this isn't mine. Hi, everybody. We're just having some tech fun over here. It's okay? Can you all hear me okay? How are you? All right. Shall we get started?
Yes.
Let's get started. Okay, so I have to warn you guys ahead of time. I was next door in the practitioner stream doing the exact same talk. Um, Not that that's a bad thing. It's just that it's all kind of going round and round in my head. And I ended up choosing to give you guys the slides that I gave the practitioners because whenever I've come to mind and talked before, I think that the parents are extremely well educated. And I think that you guys all know how to read papers and you're all interested in getting into the nuts and bolts of it. So my job, I think, is to translate it into easily communicated information for you that you can sort of just listen and sort of hear the story. And then you can go home with the notes and do the research. And then if you get stuck, you can let me know. Is that all right with everyone? Feel free to ask me questions as we go because I always hate it when I'm in the audience of something and I'm like, just answer this because I can't add the information. So as long as we stick to time, it'll be fine. Yeah. All right. So I was asked by Leslie to present, which I'm very grateful for, and she said that the theme for the year was talking about mitochondrial health. So I'm imagining that you're all familiar with the mitochondria and what it does in the body, just as a general piece. And so I have a very, very big fascination with a concept called microchimerism. Now, microchimerism is the presence of cells in another person's body. I'll explain it in a moment in a bit more detail, but it's the idea of when we're parents that we have cells from our children in our body and they have cells of us in theirs. I have a very strong spiritual practice. I'm an absolute geek with science, and for me, I'm always trying to find the bridge between the two worlds. I always want to have the scientific language for the spiritual stuff that I believe, and likewise, I always want to find meaning in science because otherwise it's just worthless. So I put together this talk because I wanted to find a bit more science around why is it that us as parents know intimately how our kids are feeling. And this is no disrespect to dads. Dads are absolutely important and we'll talk about how and why as we go. But as mothers, and I'm imagining all of you in the room are mothers, mothers, we can feel our children when they're in another country. We can feel that they need something. We have this intricate understanding of who they are as people. And science is developing a language around this now. And it's this concept of microchimerism. Then I want to sort of look at, well, what do we actually do and how do we help things, and then link it all together. So wish me luck. So, microchimerism. Now, the definition of microchimerism is the coexistence of a small population of cells from genetically distinct individuals living within the body of another individual. So we have two types of microchimerism. We have something called vertical microchimerism and horizontal. Now, vertical microchimerism is basically where the mum gives her cells to the child and the child gives their cells to the mother. Draw your attention to the fact that there are two siblings here, but I'll go through all of that as we progress. But it's the idea of that mum has cells of each of her children living in her body for her life, and the children have cells of their parent living in their body for their life. And the communication between those and what we can actually do about that. You do get from siblings, I'll talk to you as I said about it in more detail, but just note that if mum has baby one cells are also found in baby two. And then if mum has baby three, baby one and baby two are found in baby three, and it continues. And then, just to burst your brain a little bit, also her mum, and her mum's mum, and her mum's mum, and her mum's mum, and everything that goes from it. And so this is why the woman that has 4 children is more tired, for many reasons, but from a microchimerism perspective, she's got cells of all 4 kids in her body. And it's also why any pregnancy that she has, even if it's a late missed period, a miscarriage, a termination, a stillbirth, or a live birth, all of the cells from all of those pregnancies can be found in her body. So a woman that has had 10 conceptions and only 1 child has 10 lots of cells in her body. And each time she has another pregnancy, it affects her health. And that's some of the stuff that I want to talk about today. Is your brain getting your head around it? It's pretty cool, isn't it? I remember when I first heard about microchimerism, there was something on social media about every male partner that you've ever been with, you can detect the Y chromosome cells of that male partner in your body. And then I was like, hang on a second, there's got to be more to this, and this is where it gets a little bit more exciting. Now, horizontal, I'm just having it here for completion. It's basically where we're looking at organ transplants, blood transfusions, etc. But you can see that, how it's passing. And do note that if someone does have a blood transfusion, which can happen after delivery, where a woman loses too much blood after labour and she gets a blood transfusion, she can actually have the cells of the person who she's transfused in her baby, as well as her. Because it can pass through breast milk, which we'll get to in a moment. It's great and it's scary all at once. So the scientific definition of this is it's the traffic bidirectional interface between the baby, the placenta interface between the baby and the mother, okay? And so we divide it into two categories, which is basically fetal microchimerism, so the cells of the baby, and maternal microchimerism, so the cells of the mother. I might actually even put this down. So the maternal fetal trafficking is basically where it's it's responsible for the migration of different cytokines, so basically the immune cells essentially, and other factors that go into the fetus during the pregnancy, and they're both detected in a number of different immune types of cells. And so the big thing that I want you to take away with this is that the cells from the fetus in the mother and the mother cells in the fetus influence the immune health of both of them. The transfer of them happen and it persists, and there's lots of variables that go with it, and we can detect it for the entire life of the mother and the entire life of the child, and then we can actually, in rat studies, not human studies, but we can detect then the next generations and how it actually passes through as well. It persists and it affects everything about each person's health. And this is why it's not just I had a baby and I'm exhausted. Maybe it's because I had that baby. And maybe it's because of those cells of that child. And this is why, and it's not to to make that child be, the cause of the problem, but this is why when a woman has her third child, she's often the sickest after, right, versus the first. Why in clinic I will see women have these crazy thyroid crises after she has the delivery of a third or a fourth child. And I remember sitting there as a clinician going, what am I doing wrong? I've helped this woman with 3 pregnancies and it's the third one, and then she has a thyroid crisis. What have I stuffed up? Thankfully, maybe, it's not my stuff up. It's because of those fetal cells going into the mother, and each time she gets more fetal cells, it makes her immune system more erratic and it makes her immune system have more problems. And this one you can read through later. It persists and it has long-term and short-term consequences for both people involved. Sorry, I went too fast there. A couple of things I want to draw your attention to as we go through. Autoimmune diseases and cancers. It can reduce some cancers, but the incidence and the development of autoimmune diseases is paramount. And the research is actually around connective tissue disorders, and the biggest one is scleroderma. So scleroderma seems to have the most research, that the more pregnancy she has and the more fetal microchimerism cells she has in her body, the more chance she has of developing scleroderma. The thyroid we'll get to as we go, but bear in mind that there are some cancers that she has a higher risk of, which is good to know, bad to experience. The amount of them, though, are influenced by a number of things that we can do. One of the biggest things that we can do is make sure that her obstetric care is really good. That doesn't mean she has to see an obstetrician, but that she's managed appropriately, that her pregnancy itself, that she doesn't have any complications, and that she doesn't have any exposure to infections during pregnancy, and that she doesn't have any underlying infections that are not addressed. If she has an underlying infection that's not addressed before she actually conceives, the problem is then twofold, and the impact to the child and then the impact to her health is very, very paramount. And what we do preconceptually influences her pregnancy more than anything else. It influences the pregnancy and then the other factors around it and then the subsequent health of each child. But the more we help our women get them ready for pregnancy, the more we can actually make sure that the pregnancy is kinder and then the subsequent changes are kinder. And I'm a big believer, I know, I push this quite a lot when I speak to my colleagues. I don't think that women get enough postnatal care. I think they get a baby and then they go home and then they have a nurse that visits them and goes, yep, your baby's gaining weight, how are you? Okay, you're not depressed, you're fine. But no one's actually checking what's going on with her body. So a couple of things, and just let this add and build for a minute. WHO, so World Health Organization, says that every pregnancy a woman loses 50% of her nutrient reserves. Okay? So she starts the pregnancy, she loses 50% of her reserves. At the end of the pregnancy, she's 50% worse off. Then you add that she goes and breastfeeds, and they say that we lose another 50% of our nutrient reserves. So then at the end of the breastfeeding, and depending on if she does 6 months of breastfeeding, 12 months, 24 months, or 5 years, influences how much more nutritional stuff she's actually losing. And then what happens if she then starts tandem breastfeeding? And I'm not against, and I have no judgment, and I support women to do whatever they want, but if she starts tandem feeding while she's pregnant and breastfeeding the toddler, then her nutrient reserves are going down and down and down and down and down. And we don't recoup them unless we're proactive about recouping them. One of the worst deficiencies I see in women is calcium. And the women that present to me after 3 or 4 children and they're developing osteopenia at 45 years of age, because they've had kids close together, they haven't sorted out all their nutritional health, they haven't necessarily had breaks after stopping breastfeeding to actually boost their levels back up again, and then it's cumulative. And that 25% goes down to 12.5%, goes down, and you get the idea here. And the notion is that the stronger she is with each pregnancy, the more healthy the transfer of that microchimerism cell relationship occurs. The more unhealthy and depleted she is, the more the negative outcomes will actually ensue. Does that all make sense for everybody? Okay. So I'm very big on making sure that women get tested postnatally. They get some blood tests to check their nutrient parameters 2 weeks after delivery and 6 weeks after delivery. There's something that goes on 6 weeks after delivery. As a mother of 2 kids, I know 6 weeks after delivery, you kind of come out of that fog just a little bit, but you come out of it just a little bit. It's technically meant to be close to the end of the 4th trimester, and you're meant to be able to, at that point, regulate your body a little bit differently, and you're meant to be able to sort of go, okay, I'm out of that pregnancy phase, I'm now more me, yeah? 6 weeks is when women's thyroids go bonkers. They go completely crazy, whether or not she's had a history of thyroid disorder or not. It's super important that we check these things, and the research around this microchimerism is now giving us a lens with which to look through. You can read through that one. Now, this is this concept of multi-generational transfer. So multi-generational transfer is basically when I have the mother with one child, I then have her daughter or son, and then the daughter or son having their family. And what I want you to note is obviously the colours and how the colours are coming through, and that's the cells passing through each generation. And then when we take that to the next level, we can see the pedigree of microchimerism here, whereas, as I alluded to earlier, the concept of it going through siblings and the concept of multi-generational aspects and how it actually goes through. Note, it doesn't go back between these guys, okay? But this guy has an insight into their sibling in a way that the sibling will never know. And is this potentially a scientific language for transfer of diseases, for transfer of emotional patterns, of psychological well-being, of likes and dislikes? Maybe. Now, what they now have decided is that we're going to call it a microchiome. So it's kind of like when we're talking about the microbiome, yeah? So the microbiome being all the bugs. They're now thinking that they're going to call it a microchiome, because a microchiome is basically when you have multiple generations and their influence into the subsequent generations and how that's actually carried through. It evolves through recognition. The good traits and the bad traits come through, but we're getting multiple cells coming through generation by generation by generation. There's a filtration process so that we reduce how many fetal cells are left in the mother, but if she has a tendency towards autoimmune diseases, for example, she keeps those levels much more buoyant. And then the next generation it'll be higher, and etc., etc. This to me is energetic medicine through science, yeah? This to me is intergenerational trauma, intergenerational emotional patterning, intergenerational emotional connection, how your child can look and feel like your great-grandparent even though they never met them, yeah? This is science now developing a language around it, and it's definitely a watch this space, because I think science is going to start to give us language to justify our spiritual connections to our children and to justify lineage pieces of behaviours and patterns of behaviours. You can see why I'm a bit of a geek about it, yeah? If you like science, that is. There we go. This is just saying that it's found. The biggest thing that I want you to take from this slide is that the environmental factors or genetic factors determine if this becomes pathogenic or not. So the health preconceptually, the health during pregnancy, that determines whether or not something will become harmful or helpful. So if a mother has heavy metals that are present in her body and she doesn't remove them before she conceives, if she has an infection that she doesn't clear, if she's exposed to too much Wi-Fi, whatever, this is why and how it's going to have a role. it's a paradox. What we need to understand here is that a mother's immune system is the most unique immune system. They say, I've read one paper and it was saying that it's like so much more sophisticated than a male immune system, because when a woman conceives, her immune system has to down-regulate itself to accept foreign DNA and foreign tissue from the sperm. It means that her immune system is much more vigilant, it's much more specific, and that sophisticated word I think really fits here, because she can determine whether or not she accepts the sperm. Like there was a paper that came out that showed that a woman can sleep with multiple partners in one time period and can selectively choose which sperm she accepts to conceive from. What we now know is that she can also selectively choose what DNA to accept from the sperm. So the sperm can come along and can give DNA, and it's the egg that says, I will take that or I won't. That's pretty cool, yeah? And then it's the female's immune system that says, I will take that embryo and allow it to implant, and I will consistently tell my body it's not a cancer, it's not a foreign substance, I will not attack it, and allow it to stay there and to, fulfill the gestational period and to deliver a child. That immune system has to be so clever and so specific to be able to achieve all of these little variables. And that's just where science is at the moment, yeah? So what we now need to realize is that her immune tolerance and her immune response being so unique predisposes her to having a tipping. Yeah, so her immune system can be tipped into a thyroid disorder, or it can be tipped into a connective tissue disorder just from a pregnancy, because her immune system is behaving abnormally. Does that make sense for everybody? Yeah? It's the most challenging task. And that's why so many women have miscarriages. Well, one of the reasons why so many women have miscarriages, because her immune system goes either, I don't like that sperm, or I don't want to accept this child. And women often conceive but don't implant because her immune system is going against it time and time and time again, because it is hyperreactive from an environmental pollutant or an infection or whatever. Okay? There's a constant adaptation cycle that happens in her body. Every time a woman has a menstrual cycle, her uterus and the lining within that uterus, her endometrium, is constantly adapting to what it's exposed to. Every sexual partner challenges her. Every exposure that she has to an infection challenges her. And that endometrium is priming itself for eventual conception, essentially. Does that make sense? Am I going over everyone's head, or you're all with me? Or you're all kind of going through, oh my God, my family, my genetics. Oh my God, I got this rubbish. That's when we take the spiritual lens and we go, I'm going to clear it. This is just for interest's sake. I'm not going to spend any time on it. It's pretty technical, but some of you might want to look at it. All I want you to notice is just the immune changes all over, but in particular here, the changes in hormones. And then as soon as the pregnancy hormones kick in, she's got a huge change in how her immune reactivity is occurring. This is looking at basically every time she has a pregnancy, how she develops these antigens to the sperm. And so this is where you can see that the more pregnancies the little woman has, she can sometimes end up developing antigens and reactions against sperm, or positive responses against sperm, depending on the type of connection that they have. And super important to make sure that you mitigate that process. And that's one of the reasons why I'm really big on making sure that, couples are screened really carefully for all sorts of infections, and that's why they correlate with lack of implantation. When it gets pathogenic, so when the microchimerism makes it happen that it turns into a disease state, what we're looking at here, the biggest one I want to draw your attention to, is the environment. And note that this is a two-generational scenario here, but the environment is huge, the genes are huge, the infections are huge, and then there's all sorts of other aspects. This cell plasticity and organ piece means that the organ is adapting. I'm going to skip that one and just move over to here. So this is where we're looking at the immune development in the offspring, and so how much of that maternal microchimerism, so how much of the mum cells are present in the baby. They seem to, based on the research, they seem to affect 4 main areas of the body more than anything else. The thymus, which regulates the immune system in the child, the blood, the lymph nodes, again, immune, and then the bone marrow, again, immune. And so what's going on here, and in blood obviously you can factor there's an immune component too, but what you can see here is that there are consequences. So if I have lots of mum cells in me, I have more chance of developing all sorts of problems. The one that I find most interesting is if I have more of mum cells, I have more chance of being an allergic kid. You know, the kids, the anaphylactic kids that can't eat anything. More of mum cells means I have more reactivity against things. And your mind needs to go backwards and go, was mum reactive when she conceived me, which has given me that type of immune response? And is that the type of cell that's coming through? So how stable is mum's immune system in that pregnancy tells you the health of the child. How stable she is before she conceives makes her pregnancy easier, which makes the health of the child simpler. It's pretty profound. I take this scientific lens and I go, I'm glad that we're getting language and information around it. It's nothing that we don't know, it's just confirming it and confirming it. And all of you are here because you all understand the importance of this concept of preconception care. But if we continue to progress the way that we're progressing, you know, like I gave a talk on environmental toxins, bless you, last year, and we're evolving, you know, the concept of Darwinian science, where we're evolving to adapt. What are we adapting to? We can adapt to tolerate a lot of the things around us. We can adapt to tolerate environmental pollutants, but it's affecting us on a cellular level. And how are we adapting and what are we adapting to? And this is where we need to start to think about all of these allergic tendencies in our kids. Is it because of all of these things that the mum's exposed to? Yes, I think so. I don't think it's put down to the kids as much as I think it needs to be put down to the parents much more so. The important things I want to draw your attention to with respect to the fetal cells, so the fetal microchimerism cells, is that they engulf the mum's bone marrow, okay, and then they change it. So if there's lots of fetal cells present, her immune system goes even more haywire, and how much fetal cells are present in the mum is because of the health of the mum before she conceived the baby. Does that make sense? Or do you want me to say that again? No? I've got so many blank faces. I think it's just processing. Please. Okay, so I think it's because you came in late. So what we're talking about here is the idea of when we conceive our children, cells from our children exist in the mum and cells from the mum exist in the baby. The amount of cells determines if we can get a disease state or not, and the trafficking and the influence of it is more controlled by the health of the mum before she actually conceives than anything else. So what we're looking at here is the idea that if I have lots of fetal cells in the mum, what am I actually doing here and how am I influencing the mum? Does that make sense? No.
Why you have more fetal cells or not?
So the theory is that we all have a similar sort of amount of fetal cells, okay? So in any pregnancy, it's a normal phenomena for mum cells to be in baby and likewise. But the amount that is actually present, what we're realizing now is the health of the mum determines what will actually transpire, how many pregnancies she's had before, and all that sort of stuff. But if she's got an infection or she's got an environmental exposure to something, what they found is that more fetal cells are present in her, which then means more disease states are relevant for her. Does that make sense? Yeah. I'm sure that just helped everybody and I missed something there in explaining it, so thank you for pointing it out. There are three main conditions and three main pregnancy complications that are associated with more fetal cells being present. Yeah.
Just so you know that that a good way to prevent all these issues from happening or reduce the risk of that, what is the best way to do it when you have a woman and the female and the male, and you use pregnancy protocol prevention where you have clean diet, clean probiotics, prebiotics, everything to prevent the issue happening. You look at the research, it's very good. But now we like prevention. Because before that, you make sure we've got good methylation, good chelation, all these things, all these factors. Immune regulators that have anaphylactic when they get older, when the baby's born. You know, so prevention is key in regards to preventing all these issues.
Absolutely, totally agree with you. That's the whole point.
Yeah.
Absolutely. Yeah.
Prevent all these issues that produce numbers.
Yep, definitely. So, as I was saying, so the three main pregnancy complications that are associated, so the more fetal cells that are present, so the third child, the fourth child, the fifth child, there's more chance of the mother having miscarriages because there's going to be more fetal cells, and there's more chance of getting preeclampsia, which is when she's got high blood pressure and it's not able to be managed. And abnormal karyotype is basically just that the genes become abnormal. And so the more of these fetal cells that are present, the cumulative aspect to it predisposes her to those three main areas. Additionally to that is all this autoimmunity aspects that I've been alluding to. So the thyroid tissue I think is really, really interesting because, as I've said just before, just the idea that when she delivers a child and her thyroid going crazy afterwards, it's because the fetal microchimerism seems to exist in the thyroid gland and seems to make everything a lot worse. So protecting a woman's thyroid before she conceives is vital, and monitoring it really closely is vital. And making sure that not everyone is on iodine. This is controversial, just work with me for a second. Iodine is a really, really important mineral for the health and development of our kids, yeah? So we know that IQ of our kids and cognitive development and hearing and vision and everything is directly related to how much iodine they have during a pregnancy. There is a situation, though, where they can have thyroid antibodies, and one of those types of thyroid antibodies, the TPO, the thyroid peroxidase antibodies, if they're on too much iodine, it increases those antibodies. And if I increase those antibodies, I increase my risk of developing a thyroiditis, an inflammatory thyroid gland, once I've delivered my child. So this is where it's really important to test your iodine levels and to test your thyroid comprehensively before you conceive, during pregnancy, and post. And I have had a number of patients where they've delivered their children and all of a sudden these antibodies come out of nowhere because of microchimerism aspects, and they're still on high dose iodine and they can create a whole crisis. So make sure that you're not just supplementing without being aware of what may actually be going on underneath it.
What are your thoughts on thyroid antibodies in pregnancy?
So thyroid antibodies in pregnancy may or may not produce any problem. It depends if it's affected the thyroid hormones. So if the thyroid hormones are affected, then there's a blatant thyroid issue, and it's super important that the thyroid gland works well in pregnancy because the baby doesn't produce thyroid hormones itself for a number of weeks, so it uses the mum's hormones. If the thyroid antibodies are present with an abnormal thyroid function, obviously it's a whole other discussion, it's an autoimmune process, but now with all of this information, as well as other things I've seen, I do think that if they just have antibodies, it means their immune system's already unstable. So it tells you that autoimmunity is a situation where it takes glands and it kicks them off. The endocrine system, so the thyroid, the ovaries, the thymus, whatever, they're interlinked so beautifully, and it's a domino effect. When one goes crazy, the others always go crazy. And they just kind of kick themselves off. So it's about making sure that you go, there's thyroid antibodies present. I need to treat this as though there is a thyroid crisis and protect the immune system, because otherwise I'm going to make this a whole lot worse.
And how do you do that?
I'm sorry, where was that from?
How do you
Protect the immune
clear off
system?
the thyroid before?
Yeah, absolutely. So if it's just thyroid antibodies and no thyroid hormone issue, okay, and we're just looking at the autoimmunity, it's about being ahead of the timepiece so that it doesn't develop into that. And so it's about making sure that the immune system is stable. So your usual things. So diet and sleep and exercise and not having any allergenic foods and gluten and sugar and dairy and whatever. Making sure that environmental pollutant exposure is protected against an infection is really addressed. And the biggest one tends to be viruses. So viruses, particularly anything in the herpes family, so that's things like cold sores and genital warts and glandular fever and CMV and all that sort of stuff. They're the cleverest viruses because they go into the cell, they manipulate the RNA and the DNA, and they bypass normal mechanisms. So they replicate every time you get a new cell, which you do every second just about, and they're in that cell and they bypass usual trafficking. So it's about trying to work out how am I going to get that virus out. If it's present and you've got thyroid antibodies, should have done the other hands from before, if the thyroid antibodies are there and the virus is present, you're almost guaranteed that you're going to have a thyroid crisis afterwards. The problem is that pretty much everyone has one of the herpes. And so it's about treating it before they conceive. Did that answer it enough? Or did you want more detail, or that's okay? Cool. Was there another hand there? No. Yes, please.
Well, just to note that that also too, that with all these issues and everything, like, for example, also another reason why you have cold sores, computer mitochondria, oxidative stress, all these factors to do with cells, environmental health factors. And the difference is that for a lot of people that don't realise, they're not just the integrated and the functional medicine side is a lot more advanced than the mainstream medicine, because all the research is a lot more into it and aware of it, more than the mental side. Like, for example, like medicinal stuff like stillbirth, we don't know a lot about stillbirth. We do, we know a lot about all these things. It's just the way to look at it. There's always two sides of the story.
Yeah.
So it just depends. Like, so with mitochondrial support, normally the best way to support mitochondrial support is glutathione and SOD. So you use glutathione and SOD with so you have no oxidative stress and better cell production and cellular function. And another product called systemic cell America, and from enzyme systems produce stem cells. You use that with the female and the male, the person giving birth. We can have good cellular function, good mitochondrial support, good stem cell support, all these factors to prevent all these issues from happening.
can I interrupt you just there? If you let me keep going, we're going to go into that, and then it's going to be really interesting. It'll come up, but it's absolutely valid what you're saying. Totally valid, and your brain's just faster. It's good. I'm just painting the picture. No, it's good. I like it. So, a couple of things that I want to draw your attention to as well. Okay, so the fetal microchimerism cells, so the incidence of causing more harm, is higher after a cesarean delivery versus a vaginal delivery. Lots of theories around that one. Okay, one theory that I have is, again, I want everyone to have whatever birth they want to have, how they conceive. I don't judge. I just look at science. A cesarean delivery means that the hormonal changes in the body haven't been initiated for the placenta to eliminate, through the umbilical cord, to eliminate a lot of those fetal cells back to the child. So if they're not having a vaginal delivery, they're not actually passing that through as efficiently. Cesarean deliveries has its pros and cons, okay? I'm not saying it's blatantly problematic. I am just saying that there is a lot of research around cesarean delivery and, microbiome changes and immunological changes, and some of it might be related to not actually having the cord to stop pulsing and to be going back into the child and all that sort of stuff, which returns some of those fetal cells back to the baby. Interestingly enough as well, and similar sort of vein of thought, is that they're higher, the microchimerism cells are higher after a termination of pregnancy, so TOP is termination, versus a miscarriage. And is it because the miscarriage allowed the body to start to separate between the two people versus a termination which cut it short? And so it's this whole idea of, as I said at the beginning, every conception that a woman has, be it miscarriage, termination, whatever, those cells will be present, but then the delivery method of that child and the termination of that child or the loss of that child will influence that as well. And so we need to be thinking about ways in which we can support people to protect against harmful situations. I included this here, it's quite interesting, but definitely I just wanted you to see that the main autoimmune diseases are listed there on the left, and sclerosis has the most research, and that's a connective tissue disorder, which, to be honest, science doesn't really have a lot of understanding around. They just kind of go, here's some antibodies, this is your presentation, you fit the criteria, we can't really help you. Okay, and it's an interesting one, but we're dealing with the immune system, going back to your point about the autoimmunity, the immune system attacking just another cell in the body. And why is it attacking the connective tissue? We don't have the answer for yet. This is looking at the development of cancers, and when you do get the slides, you'll see that there's carcinogenic versus protective. The colour coding will make it easier for you later. Some of them are carcinogenic, and note that its cervix can be protective or carcinogenic. Uterine cancers are predominantly carcinogenic if there's higher levels, and skin cancers, and then breast cancers as well. But then you can see thyroid is protective, which doesn't make sense. So I think this is let's keep watching where science goes with it, but note that the risk of cancer, both prevention against and development of, will be related to that fetal microchimerism. I wanted to include this just because I think the breastfeeding microchimerism is really, really interesting. There's a little bit of research that's starting to come around the breastfeeding microchimerism, but we know that there is a transference of cells, microchimerism aspects, and what this particular table is doing is it's comparing it, but the impact, the positive impact from the maternal microchimerism through breast milk is only for a few days or weeks, okay? Versus the pregnancy one, which lasts for a lot longer. But it is helping us to understand that breastfeeding, again, there's another part of benefit as to why we should be encouraging breastfeeding. Okay, does that microchimerism part make sense? Ish? Any questions about it? Yeah?
Sorry, I just want to thank you for blowing my mind here because it just was all making sense. But yeah, so my firstborn was a C-section. I planned in home birth. C-section, but my preconception was like perfection. And my firstborn, even though it was C-section, I did lots of things, microbiome, etc. He's so healthy, like he's even healthier than my second one, which is Hendrix. But he was born at home, vaginal birth, did everything again. But now he is, I can see he's healthy, but his skin is like really sensitive and he blends up to histamine and stuff like that. I'm like, what did I do wrong? Like I did all the things, his vaginal birth, etc. But I'm realizing now what's probably happened is here's the connection between us two and me being not as great with my preconception care with him. There's obviously
Possibly.
affected him.
Possibly.
And I'm also tandem feeding both of them as well still. So now I'm like, should I try breastfeeding? Because I'm like, I feel like myself I'm depleted.
That's sort of my diagnostic usually. So it's how is the mum feeling? And it doesn't mean you can't tandem feed, but you might need to then look at some additional supplementation and additional dietary changes.
Yes.
Sorry, you go.
Sorry, I just want to know how long. So I want to fall pregnant again, but obviously not
Yeah, there are some guidelines.
Or
Yep.
wait and then like start with the preconception care again? Because obviously with him, I realised like the next time I fall pregnant, I definitely need to ramp up my preconception care again because obviously every pregnancy you just said like, you get more and more depleted. So is there like a time frame between like?
Yeah. So what I usually say to people, first and foremost, as I said, and I just always use this as a caveat, you do whatever is right for you, and I support that. What we know, though, is that nutritionally babies need to be breastfed or formula fed until 12 months of age. So they need one or the other. Preferably it's breastfeeding. Then if you choose to breastfeed beyond that, the literature absolutely shows some positives. It also shows some negatives for the child based on toxin exposure through breast milk and things like that. But I'm not even going to get into that. You can grab me outside. But the 12 months is the minimum. If they're happy to just do like cookie cutter scenario, they do 12 months of breastfeeding, they then have 3 months where they get their nutrition right. No more breastfeeding, no nothing, and you just get your supplementation right, you get your body back, you get your cycle normalized, everything right. You can then go into the next pregnancy where everything is replete. The ideal scenario is that you support the woman through the 12 months of breastfeeding as well, obviously, but the 3 months should be enough of a window. At least three. But if you've been doing tandem, I'd stretch it to 6. Yeah. Yeah.
Questions back on your previous slides with the other lot of miscarriages. So it's kind of blown my mind. It actually makes a lot of sense with the thyroid leaking and
Yeah.
all of that. I want to know, is there a difference between the cells leaving the fetus or leaving the body with the miscarriage, if it's a natural miscarriage or a DNC?
Yes. And that's where you look at the research versus termination versus miscarriage. So the natural miscarriages are always the better scenario because the body is doing a clearance mechanism. And so that's where it's the vaginal delivery versus the cesarean, the termination versus the miscarriage. Any situation where the body can go through a natural physiological process, it has some inbuilt mechanisms to clear it.
My cycle always goes straight back to normal after I've had quite a few. And I had about 12 miscarriage end of 2017, and I had to have the recommended DNC because it was far along, and they wanted to obviously look at the tissue after 17.
Yeah.
And I finally, even though I waited 2 weeks for my body to, from no heartbeat to go through my body to spell the baby by itself, but it didn't.
Yeah.
It literally took me, I'm still recovering more than 12 months later from the DNC.
Yeah, and that's where a lot of treatment strategies to clear that baby out are really helpful. Kinesiology, energy work, that sort of stuff, absolutely. There are some great herbs that can actually just help the uterus to actually shed. And so that's when we talked about, the endometrium, the uterus being so immunologically unique. It's about resetting that balance. And if you've had multiple miscarriages, also bear in mind that every time we conceive, it takes an implantation site. So I don't know how many miscarriages you've had, but let's say, hypothetically, not you, hypothetically you've had 5 miscarriages. It's taken 5 spots in the uterus, which means any next conception are not going to take those 5 spots. We never implant in the same spot. And women will know this, that when they conceive, they'll be like, oh, I know I conceived on the left of my uterus. And then the next one, I know I conceived on the right. And you know your kids. And this is the spiritual bit. I've got 2 boys, and when they come over and I know they need something, I'll feel a pull on that spot where they implanted. And they're so different because my second was central and my oldest was on the left. And I can just be doing a meditation and thinking of my kids, and it's the body has it in it.
Can I ask, is there a certain point though in your specialty, with your experience, that if you've had a certain number of miscarriages, is there a point where you just think stop?
There's a point where
I think like you said, health-wise, I think it's not about what I want. It's if I can't conceive, there's nothing wrong with me health-wise. I've had diagnostic tests with my husband and I, and there's nothing wrong with that DNA or anything like that that they can actually fix.
Yeah.
So there's nothing that I can do treatment-wise, but I just think to myself, if my body isn't allowing me to do this
yeah.
X amount of time, so I've had 7 before my daughter, 2 of those are multiple, so one was on a skin, and then I've had 4 since birth. And so I just think if my body, and I'm very healthy.
That's 12 conceptions though.
I've had all of these conceptions.
Yep.
And my body, and it's been more than 12 weeks. It's not like it's not an implantation issue. It's not something
Yep.
early on.
Yeah.
Do you just get to a point where I'm at this point now? Do you just not try because you think if I eventually, and my daughter wasn't a healthy pregnancy, I was very sick. She was sick, so I just feel like, do you just stop? Is there a point where you just?
Number one is your quality of life. So number one is your quality of life, and do you have a yes to continue or not? I've never met a couple that I haven't been able to work out what was unexplained though. I think you just have to go digging until you find the answer. Pardon?
My thyroid has been.
Yeah, so there's obviously clues in your body, and there's parts that we need to try to work through and identify, well, what is it, if you have a yes. But there is definitely, from scientific perspective, there's a load on your body. That's 12 conceptions. That's 12 lots of fetal cells still in your body. So there's a load nutritionally, there's a load on your thyroid, and has it made your thyroid gone beyond? I don't know. I don't know your details. I can't make a comment. I have had a number of patients in similar scenarios though, and we have been able to give them successful, healthy children. And the healthy bit is the one that I want to highlight, which you've highlighted, which is, okay, I can conceive, but is this child going to be, significantly intellectually disabled or something? And this is where the next part, which is all about mitochondrial health, the more damage we have to our mitochondria, the more we're influencing the health of our kids. And then generationally, what are we doing? So you make that call, and I respect whatever a person chooses for themselves. I have had a card. I've got 5 minutes. So I'm going to give you just a quick summary about the important things for mitochondrial health. So what we're looking at here is the mitochondria within the cells themselves, but particularly the mitochondria within the eggs and within the sperm. Now, the human egg, the human oocyte, has more mitochondria and mitochondrial DNA, so that mtDNA stands for mitochondrial DNA, than any other cell type. And the mitochondria will mediate the reproductive competence, so whether or not the person can conceive and what they can do with it. Lots of information that you can read through yourselves later. What you need to know is that mitochondrial DNA is maternally inherited. There are a couple of case reports where it's been paternally inherited, but for the moment we know that it's the mother's mitochondrial DNA that influences and gives that to the child. But the male itself, what you need to be mindful of is that if there is oxidative damage to the sperm, it means that the mitochondria has had some element of damage, which means that it will be impacting the health of the child. And the analogy that I always use for this is one that one of my old lecturers gave, Ron, I think you've heard it even, is the idea that the sperm itself, whether or not the sperm has any damage within the head of the sperm, it's called DNA fragmentation. And any damage and anything that we don't have science to be able to test comes over to the egg, meets the egg, and then the egg goes, I'll go tidy all that up for you. I'll then enable us to have fertilization. I'll then clean my own egg up. And then I'll enable us to have implantation and do what we actually need to do. And it's the egg that is responsible for doing all these things. So if there's ever a situation where the male is going, a bit ambivalent, it's all about the egg, you're 40, it's your eggs are old. No, she is 40 with 40-year-old eggs, but her 40-year-old eggs are cleaning up your 40-year-old sperm. And your 40-year-old sperm may have more garbage because you're older. So the thing is that sperm regenerate, okay? Every 72 to 76 days, guys get new sperm. So anytime they ejaculate, that sperm has sperm that are 1 day old all the way up to 76 days old, okay? If there's something higher order, other medical problems, it's a different story, but they sort out their sperm and they respond to treatment faster than anything else. Women, however, born with their eggs, the health of your mother or even your grandmother, if you look at some of the research, your egg that was in your maternal grandmother determines your health of your eggs. And maybe all the miscarriage pieces are because of your maternal grandmother. So there's what's called trigenerational studies where they look at the maternal grandmother. And the biggest one, if you're really interested in it, is the Dutch famine studies, which looked at the maternal grandmothers and how they went through famine after Second World War and how that made their daughters more infertile and their granddaughters unable to breastfeed. So there's lots of trigenerational stuff, and the microchimerism might be the transport mechanism for it. But if we go back to the guys, because we have 5 minutes, it's all about the regulation of the oxidation and keeping it in balance. Women, though, the older they get, the older their eggs get. Less mitochondria, the older the eggs. This is basically just a study where they looked at one case in 2016 in Mexico where they took the mitochondria of an egg from a donor and put it into the embryo of a couple because they had a mitochondrial disease, and they were successful in not actually transferring that disease to the child. It's a little bit of Gattaca. You remember that movie Gattaca? It's a little bit of that sort of genetic CRISPR where we're adding a bit here, but nonetheless it was successful and the child's still alive. However, these are the main sources of where we're going to get all of our damage. Note that with women, the highest source of reactive oxygen species damage, so the highest amount of oxidation and damage to mitochondria, diet is number 1 for women. Then drugs, then smoking, then alcohol. Conversely, men, number 1 is smoking. Then alcohol, then radiation, because the testes are external to the body. So the mobile phone in the pocket, cooking the testes. Yep. And then toxins. Diet, number 1 for women. Number 1. So, there's groupings of how the prescriptions and what you choose, and I'm just going to race through this because I don't have a lot of time. These are the main things that you can see that they've done all the research on, but probably the biggest one is, there's a handout that you'll get later, the biggest one is CoQ10. Now, CoQ10, there's been some great research around it for men for a long time. It improves absolutely everything for men. It's all about how much they get and the form of sperm, and the dose needs to be high enough to make an impact here to the mitochondria. And women, the research is fantastic. I mean, I can delay women's menopausal onset by giving them CoQ10 because it improves the health of the mitochondria. But the dose is like 600 milligrams. Yeah. You'll get the slides later, you can sort of read through it. Some other really interesting substances. The last one that I want to talk to you about is glutathione and melatonin, just because CoQ10, glutathione and melatonin are the three main substances that you need to be taking if you're wanting to improve your mitochondrial health and improve all of that microchimerism scenario. Glutathione is a substance that's naturally occurring in the body. People tend not to supplement it sufficiently, but what it seems to do is it improves and reduces all of that oxidation, and it makes all the other nutrients work. So if you're wanting to really improve the mitochondrial health from a fertility lens, glutathione at the right dose makes an enormous difference. And when you combine glutathione with CoQ10 and melatonin, you get the best combination. And the research around melatonin, which is something that's a hormone that's secreted by the pineal gland that regulates our sleep cycle, it's a powerful antioxidant. So having enough sleep is makes a massive difference, but giving the melatonin as a prescription with those two other substances is probably the most powerful thing that you can do to improve the health of your eggs, both from a conception perspective, but also from if you're approaching menopause and all those sorts of other variables as well. I can't actually take that question because I have to wrap up, sorry. I just wanted to sort of end this. There's lots of other information that you'll get through in the slides later, but I just wanted to end this with, if nothing else, I want you to take this scientific information as a source of empowerment and as a source of justification for the spiritual connection that you have with your kids. You know, there's that great book that I've read to my kids for many years called The Invisible String. I don't know if you've heard about it. And it talks about that no matter where you are, you're connected to your kids. This is science giving us a language for, I can feel my kids when I'm in another country, and I know my kids better than anybody else, and my maternal and paternal wisdom cannot be underestimated. So if nothing else, it's not to freak you out, it's to give you a sense of empowerment, and hopefully when you look through the slides there's a lot of strategies there for you as well. So thank you very much.
LEAH, on behalf of mine, as always, thank you so much.
Thank you
Brilliant
so much. Thank you so
presentation.
much. Thank you.
We're going to take a break.